Thank you for watching On Call for All Kids. Today we are talking about constipation. We'll be discussing what makes constipation so common in children, when you should see a healthcare provider, and how constipation is treated. I am joined by Dr. Michael Wilsey. He is a pediatric gastroenterologist at Johns Hopkins All Children's Hospital. Great to see you, Dr. Wilsey, and thanks for being here.
Thanks for having me, Ashley. It's a real honor and a pleasure.
So let's talk constipation. What is it?
Constipation, Ashley, is very common. We see this all the time. And constipation is defined as either a decreased frequency or painful passage of a bowel movement. Typically, children 1 to 4 years of age typically have 1 to 4 bowel movements a day. Most children go at least every other day, although some of these children may be constipated. When children are constipated for a long time, the colon or large intestine can stretch, and then fecal retention can occur. Over time, the children may begin to soil their underwear and have smears. Fecal soiling is involuntary in children. Oftentimes, children don't know that they're having it and don't have any control over it.
And so, how common is this with children?
Constipation is very common, Ashley, especially in preschool and school-age children. Up to 3% of visits to the pediatrician and up to 25% of visits to pediatric gastroenterologists like myself are related to constipation issues.
And why does constipation happen?
Great question. So constipation can happen for a variety of reasons. Typically, we try to sort them out into either organic or functional constipation. Organic constipation typically has an identifiable cause, such as an intestinal or spinal cord issue. Functional constipation describes those children whom constipation doesn't have an organic etiology. Unfortunately, for us, most childhood constipation is functional. Functional constipation occurs commonly from stool withholding behavior in which a child wants to avoid painful defecation. And can vary by age as well. In infants, straining and difficulty passing an often soft bowel movement is related to either an immature nervous system or incoordinated defecation, which we typically call infant ischemia. Sometimes healthy breastfed infants can have infrequent bowel movements in which they go several days without having a bowel movement, but this can be normal. In school-age children, constipation often results from changing the diet or the routine, sometimes during toilet training or after an illness. Anything that gets the children out of their normal routine can affect their stooling routine. Occasionally, children may stool withhold when they're reluctant to use unfamiliar toilet facilities. This occurs commonly in school-age children. Once a child's been constipated, retained stool can build up and slowly stretch out the colon. Over time, an overstretched colon doesn't work properly and retains more stool. And defecation becomes painful for the child, and many children attempt to stool withhold. Stool withholding behavior includes stiffening, squeezing their buttocks muscles, crying, crossing their legs, and typically when they have an urge to have a bowel movement. These stool withholding behaviors are often misinterpreted as wanting to have a bowel movement. Stool withholding makes constipation worse and treatment more challenging.
And so, for parents, when do we know when we should actually go see a healthcare provider because of the constipation?
Excellent question. Yeah, most parents should consider seeing a healthcare provider. One, if it develops painful, hard stools that are difficult to pass. Two, if the child develops blood in the stool, soiling accidents. Three, consistently skips days without having a normal bowel movement. Or four, has large stools that clog the toilet. Other symptoms that may accompany constipation include abdominal pain, bloating, poor appetite, and irritability. In most cases, there's no need for testing prior to treating your child for constipation. However, depending on the severity, a doctor may order tests, including x-rays or other tests to help clarify the child's situation.
So you mentioned treatment. How do we alleviate and get rid of that constipation?
Yep, great question. So treatment with constipation varies according to the child's age and the cause of the problem. For some children, only requires a change in diet, such as increasing fiber, often with fruits and vegetables, as well as increasing the amount of water to drink. Other children may require medication, such as a stool softener or laxative. Fortunately, stool softeners are not habit-forming and may be taken over long periods of time. If children develop soiling accidents from overflow incontinence, it may take time for that stretched out colon to return to a normal size. Some children with fecal retention require initial clean out to help empty the colon of a large amount of retained stool. Typically, this entails using laxatives or even suppositories or enema for a short period of time. It's also very important for treating children to reestablish a bowel retraining program. Having a child sit on the toilet for 5 to 10 minutes after every meal to help build a daily bowel habit. Using a footstool can be very helpful to promote complete evacuation with defecation. and importantly, praising our children for trying. If the child's not yet toilet trained, it's best to wait until constipation is under control before starting.
Well, Dr. Wilsey, thank you so much for joining us today and providing your insight. We really appreciate having you.
Thank you, Ashley. It's a real pleasure.
And thank you all so much for joining us. Don't forget, you can also visit our website. It's hopkinsallchildrens.org/newsroom. There you'll find a lot of great information in pediatric healthcare and other wonderful resources for your family. We'll see you next time.